Okay.
But that is not under sickle cell.
Right.
Yeah.
We've heard a lot about sickle cell. Again, like I said, you know, with churches, you know, where they tell you check your genotype before you marry, and there's AS, if you marry, you have SS and all of that. In recent times also, study has proven that, you know, you can drain the blood and replace the blood. How true is this?
Okay, so basically for I think what is behind that teaching is we have something called bone marrow transplant.
Okay.
Okay, so the bone marrow transplant is basically if somebody has a sickle cell disease, you would want to change what is producing the sickle cell. That is the bone marrow. So we look at that as a cure for sickle cell disease, but it is very expensive. And for that one, the aim is that if I'm replacing that bone marrow in my body with somebody who doesn't have the sickle cell disease, then subsequently the cells that will be produced will not have the sickle cell.
Right.
But that is not a feasible option now because though it's effective, it's very expensive. There are so many other things you have to look at. Yes. Okay. But you always have to make sure that the person is optimized, else the person receiving that bone marrow the body can reject it. There have to be so many investigations done to make sure that it is the bone marrow being given matches with the person's own body. So there are a lot of risks and complications associated with the bone marrow.
Is there any age limit for people who get the bone marrow?
No. There is no age limit. There's no age limit.
Anybody can
so anybody can go for it. But because of how expensive it is, it's not usually affordable for everybody to just
ordinary man. Okay. You have to be of a certain class, or probably contribution have to be made before
it depends on your financial.
Right. Now let's talk about the symptoms of sickle cell.
Okay. So right from the babies, okay, usually around 4 to 6 months of age, you realize that babies with sickle cell, they usually have swelling of their toes or their fingers. Yes. So that is usually around 4 to 6 months. That's when those ones come. But there are other presentations. For some people, theirs is basically the bone pain. That is the most common symptom that a lot of us know, the bone pain. For others too, they have theirs where they have issues with breathing, coughing, fever, and all that. For some people, they end up, their cells break down. So their urine becomes very dark and black like Coca-Cola, with their eyes also becoming yellow. For other people too, their tummy, we have our liver and our spleen, so they feel that their tummy is enlarging. Good. So all those are symptoms and signs of the person being in a sickle cell crisis.
Are there any triggers?
So the trigger for sickle cell is a person-to-person factor. So for some people, their triggers may be different from others. But we have risk factors. So the risk factors, we have infections. Certain infections can just push somebody to get their crisis. And then, so if you are dehydrated, if you are not taking in a lot of water, we always advocate that for sickle cell, you have to be taking in a lot of water. There are some people, so it's just because of stress.
What's the quantity that you need to take in a day? Okay,
so the recommended quantity is at least 3 liters a day. That's about 6 sachet waters or bottles, like a 500 ml, at least 3 liters a day.
And it can keep the pain away?
Yeah, so the idea or concept is you are hydrating yourself. So you are not allowing the cells to get together or clump together. You're allowing them to move freely in the body. So we always advocate that hydration is key.